Would you explain your bill and then we'll let them?
SB 109. First of all, this is a bill to currently there are only 2,460 licensed social workers in the state of Alabama. We know that this is a growing trend and something that in every area, not only in healthcare but law enforcement, social workers. In addition to that, we talked about pardons and parole, corrections. Everybody that came before us during the general fund budget or just public hearing talked about the need for more people, and so. To get to the level of licensures, in this particular bill, you must have to have a master's or a doctorate degree in social work, work 3,000 hours, 96 hours in clinical supervision, and of course, pass the national exam. It goes on to talk about what this bill would do is to line us with every state. We talking about every state. Alabama is the last state to move in this direction. Alabama is the only state where they are not allowed to diagnose those situations that come before them. So a licensed medical social worker can obtain their license in Alabama and go to another state right now and practice. And we wonder why we have a shortage right now is because the people that we train go somewhere else to do what they're doing. We're not attracting anybody here because we understand if you've got a license in social work and you have passed all your tests and master's or doctorate degree, don't come to Alabama. We realize they have a shortage. You can get a job there, but you're not going to be able to practice. So this basically allows us to have some gain reciprocity with other states where they are able to diagnose as other states do. This bill would allow clinical social workers to diagnose within their scope of practice common areas and the scope of practice of clinical social workers that include diagnosing depressive disorders, anxiety-related disorders such as adjustment disorders and PTSD. They cannot prescribe any kind of medicine, diagnose, or treat those conditions that are outside of their scope of being certified to administer any psychological tests or anything like that. So basically, and this month, we just found out that the Alabama Department of Veterans Affairs has notified all of the clinical social workers that hold an Alabama license that they're going to have to obtain a second license in another state or lose their job because they cannot diagnose. So understand, this is a critical issue. Again, Alabama is the only state. This will just put us on kill with everybody else. So.
Well, thank you. I just want to make sure on page 3, so this is what they're not allowed to do. That's the way I'm reading that. They can make the plan that might include these, but they're not allowed to do them per se. You're shaking.
Right, right.
Okay. All right. And Senator Roberts, I believe you had a question or two, or
Senator, thank you for answering my questions. I've read this 3 times, and I'm still not clear. I know I'm slow on things sometimes. So I read through what they're not allowed to do. Once they would make some type of diagnosis, who is next here to do these things?
They would refer those people to someone in another profession that is trained to diagnose or do whatever that they need to have done. They are not allowed, this does not expand the scope. It just allows them to do what they have been trained to do.
okay, so like on page 3 again, if they would send to whoever, the psychiatrist, whoever, to do the ECT, which I haven't seen done in a long time, but I assume it's still used successfully, and that would be still at their judgment whether they want to perform that or not.
Right.
It's just they're making a treatment plan,
Exactly.
and whoever they refer to can or cannot follow that treatment plan.
The problem, one of the problems that we're having is I was talking with someone in the area. They do exactly what you're talking about because they cannot write up any plan or prescribe people. People just don't go any further. They end up coming back to the same person because that's the person that they have a relationship with. So I know we were down in Shelby County at one of the facilities down there, and I trying to think of what it was, but there's a dire need of social workers and people, and as a matter of fact, that was one of the items that they said they were going to request to put in their budget, a request. They are constantly doing fundraisers, but these are people that are are going to be, in some ways, well, in many ways, limited, but dependent on someone to help them to maintain and live a normal life. But that's social work.
Okay. Any more questions for the sponsor?
Mr. Chairman. I'd just like to thank Ms. Coleman, Senator Coleman, Madison, for bringing this bill, and I move for favorable.
We have an amendment.
Oh.
The bill has already passed in the House.
Would you like to offer the amendment?
I'd like to offer an amendment, and what this does, it just
second.
makes it identical.
Okay, so this just,
And it is a worked on, something, an agreement that worked on with the Healthcare Hospital Association, so Medical Association. So if anybody has any questions,
yes.
Can,
Ms. Weaver.
can we read that amendment?
Sure, absolutely. Would you like to? You want to read out loud or just time on your, if you will, read it out loud?
Replace line 70 on page 3 with the following. Using electroconvulsive therapy, nothing in this section shall be construed to create a requirement that any health benefit plan, group insurance plan, policy, or contract for healthcare services that covers hospitals, medical or surgical expenses, health maintenance organizations, preferred provider organizations, medical service organizations, physician hospital organizations, or other individual firm, corporation, joint venture, or other similar business entity that pays for, purchases, or furnishes group health services to patients, insured, or beneficiaries in the state, including entities created pursuant to Article 6.
So what we're saying is they can make the plan and the recommendation, but there's no guaranteeing anybody's going to pay for it. Please. Would you state your name?
Nico Corley with the Medical Association. Thank you, Mr. Chairman, members of the committee. As Senator Coleman Madison said, this piece of legislation
Right. Okay, and do I have a motion to adopt the amendment? Ms. Weaver, second by Mr. Hovey. Did I just call you? I guess, well, I apologize, it's the beard. I apologize. Would you call the row? And I guess you'll be the first on the row.
Chairman Holly, Mel, I'm sorry.
Thank you there.
Senator Beasley, Senator Bell,
Sorry, Lance.
Senator Butler, Senator Chastain, Senator Coleman Madison, Senator Gavan, Senator Roberts, Senator Shelnut, Senator Stewart, Senator Weaver, Senator Williams, Senator Stutz, Senator Melson.
Aye. And Senator Roberts was an aye.
Okay.
Okay, 9-0. The amendment was adopted. Do I hear a motion on the bill? Senator Weaver, second by Mr. Williams. Previous row, any objection? Okay, bill's given a favorable report. Call the next bill, please, if I can get it straight.
SB 28 by Senator Melson.
This is the bill I carried over last week. I do have a substitute. Just briefly, the substitute, what it does is it makes it clear that the amputation could be at the show part joint. And also it took out, there was some leading wording that made it out like they can do general anesthesia, which they obviously don't do that. So that's all the substitute does. So I'd like to make a motion to adopt the substitute, or if there's not any discussion, if there is, I'll be second. Senator Williams. This is on the substitute. Would you, any discussion or question?
So move
Okay.
for approval
All right.
of this.
Call the roll.
Senator Beasley, Senator Bell, Senator Butler, Senator Chastain, Senator Coleman Madison,
Aye.
Senator Gavan, Senator Roberts, Senator Shelnut, Senator Stewart,
Aye.
Senator Weaver, Senator Williams, Senator Melson.
Aye. 981, the substitute's adopted. Now we're on the substitution. Just quickly before we do that, I just want to make one thing clear after some things that were said at the last meeting. When a podiatrist gives his case report, there was some discussion about whether that afterwards about what counts toward their graduation recording of cases. You have to actually be the one that does the case or first assists the case. There's no second assist or even being in the room. So it's an actual case involvement. So I just wanted to make that clear. I'll make a motion to okay, second by Coleman Madison. And on the substitute, we'll call the roll.
Senator Beasley, Senator Bell, Senator Butler, Senator Chastain, Senator Coleman Madison, Senator Gavan, Senator Roberts,
No.
Senator Shelnut, Senator Stewart,
Aye.
Senator Weaver, Senator Williams, Senator Melson,
Aye. 7-2, the bill's given a favorable report. Thank you, committee members. And again, I'd like to apologize to Senator Bell.